worries about a pandemic at this point?
No, we're not at all, and it's going to be just fine. Whatever happens, we're totally prepared.
How does something this monumental and this dense come together in the end?
I mean, there's a reason there were 3 directors on this film. I mean, it was a lot of work.
Yeah.
And not only that, but a team of crack associate producers and also extraordinary editors. And we were all working like 24/7 starting in early May. So I think that was critical. And also I think the advantage that we had was that we weren't chasing the news. We were purposefully focusing on the early days of the pandemic, and that made at least our focus a little bit easier.
How was it shot in secret? What did you guys have to do? Were there any sort of roadblocks you had to jump by being secretive?
I mean, the key thing was really not announcing it, to be honest with you. I mean, it's not like we were on burner phones or anything like that, though we would communicate via signal from time to time. But I think the key thing was just having it fly a little bit below the radar, because we were interested in trying to persuade people to come on board and talk, particularly people who might either still be in the administration or perhaps who had just left the administration.
There's somebody like Rick Bright who his whistleblower complaint came out right around the time we started working on this film. It was very fresh. He was still, he'd just come out of hearings, congressional hearings, and getting access and sort of winning over his trust took a really long time. And I think had there been press about this film that we were making, that certainly would have potentially made him more hesitant. And
that was something that really stood out to me in the film was, the number of people who were whistleblowers or who actually spoke up. And the thing is that I feel like people are losing a lot of faith in their government and in their leadership under the Trump administration. And it was just really kind of heartening to see there were people that stood up.
It was good to know that there were these people, but also it was extremely upsetting that the knowledge and the know-how was there, the information was there, and these people were not listened to. I think that was quite disturbing and upsetting.
I mean, when you read the Red Dawn emails, which is this, group of career scientists and a lot of, public health officials and some people within the federal government, that they knew in January how bad this was going to get. They knew it could spread person to person. They soon learned that it could spread asymptomatically. They knew the dangers of a respiratory virus, that they were sort of trying to shout at through these emails to federal officials who could do something about it. I think in the early days, it felt like we're like, oh, this is this unprecedented virus. We've never seen anything like it before. We don't know how it's going to respond. It's just not true. There were experts who did know exactly how it was, going to unfold, and they predicted it, and their warnings were ignored.
A lot of the people that we interviewed who were doctors or scientists were inspiring in a way. And that's kind of the tragedy of the story, is that all of their skill, all of their dedication to public health was undermined and upended by an administration that simply wanted to put politics above everything.
Yeah.
But it shouldn't undercut their idealism and their dedication to really doing the right thing, which is inspiring.
What do you think the fundamental reason is for the difference between Canadian response or the Canadian results and the US results?
I think it's leadership. I mean, if you look at, that was the other temptation, in terms of looking to South Korea, was to look at cultural differences. But I think cultural differences can be overdone. I think in Canada it was leadership. And also Canada has a tradition of being a bit more responsive to the government. Citizens are a bit more responsive to the government. I mean, you have nationalized healthcare. Yeah. And by the way, just saying that also makes a huge difference. In other words, that was a big problem here, is that people, didn't have access to healthcare and suddenly had to worry about, the cost of getting a COVID test if they could find one. So both that sort of sense of nationalized healthcare leadership and a sense of a more of a less cynical attitude toward the government, a sense that the government is working on behalf of the people.
Based on everything you've learned, shooting the movie, directing this movie, talking to these people, what do you see for the future with COVID in the United States?
It's a virus that we still haven't gotten under control. We're still lacking PPE. Our hospitals are, we get emails from people working in hospitals saying they still don't have masks. They're still wearing masks for weeks at a time. There's so much that needs to happen. I think we can only hope that, the messaging can change coming out of the government that can be more in line with the scientists who actually know what we need.
I think we know what's going to happen if Trump stays the president. I mean, I think there are no surprises and questions there. Unfortunately, he has shown us what he's going to do with this virus and this pandemic. He's had months to be a leader and help his people, and he hasn't done that. The question is, if there's a change of leadership, what will happen? And we just have to stay optimistic that, people will listen to scientists and will listen to scientific advice and somehow we'll get this virus totally under control.
We just don't know. And I think that in some ways, the future could be bright. We know a lot more about the disease than we knew at the beginning. And with proper policies in place, it can be managed. And of course, we're all hoping that there's a vaccine somewhere in the future. But the big problem now is that there's no plan. There's no coordinated federal plan in order to deal with it properly. There's just the purposeful absence of a plan. And so, the future really depends on what happens on November 11th.